All right, this is the lumbar posture pump. I'm a big fan of the posture pump because it's proven to be safe and effective, and this is a great at-home traction device that you can be using in conjunction with your therapy here in the office. I'm not a big fan of a lot of the traction devices out there. I mean, you can go, this day and age, you can go on Amazon and spend $50 and buy some knockoff traction device. I like the posture pump because the same doctor that helped develop the non-surgical spinal decompression with the DRX 9000 also has done research and helped develop the posture pump. So this is the only at-home traction device that I recommend to my patients. And what we're going to be showing you right now is we're going to be showing you the posture pump for your lower back. This is called the Pentavec. It comes in a nice drawstring bag, so that way if you're traveling, you can always travel with your pump. But you own this, you can use it every single day. A lot of my patients will, on the day they do a DRX treatment, they won't do a posture pump treatment, but they work really well together. Missy's gonna be our model today, so Missy, if you would, go ahead and put the small of your back here, and your feet will go right in here. So what we're trying to do with the posture pump is we're trying to put extension into the lumbar spine. And so as Missy just lays on this, it is extending her lumbar spine, which is good. There's a couple different ways that we can set this up. The first, we're going to extend the foot pedal here. So Missy, there is a clip in between your knees. I'm just gonna flip that clip, and I want you to extend your feet just a little bit more, okay? All right, so just extend your feet a little bit more, right there. Does that feel okay? Wonderful. Now they will have this strap that can go around your body. Some of my patients have said that that strap is not big enough. Some patients say it's not small enough. So for this, the strap really isn't as important as it is on the cervical piece. The nice thing about this one is it's got a dual bladder system, so it's got 2 bladders here. What we'll do is, Missy, if you would, I want you to straighten out your legs. Cool. When you straighten out your legs, do you feel anything under your back? Like, do you feel those bladders get bigger? Yeah. Now I want you to bend your knees. Perfect. And that doesn't go down. So I want you to get where you have a little bit of a bend in your knee and then straighten out your legs out so it puts some of that air in that bladder. So you can go ahead and do this. Flatten your legs. So there's 2 different bladders. I want you to start pumping up one. And Missy, there's two bladders. Which one do you feel like is pumping up with this one? Do you feel like it's the top one or the bottom one? The top one. So the manufacturer will recommend to do one of them to start and then do the other one. So what you can do is just pump up the top bladder. The manufacturer typically recommends to do about 5 treatments. Missy, when we pump up the bladder, are you feeling that kind of intensify that stretch on your spine? Which is good. That's exactly what we want. So we'll pump up to 5. And now, Missy, are you feeling the second bladder? Yeah. Does that intensify it even more? Mm-hmm. Cool. So what you can do is pump this up to about 5, hold it, and then you can let down one of them and then the other. So you can hear the air actually coming out of them. But what we're doing is we're extending the lumbar spine, we're relaxing. Extending it, relaxing it. The posture pump works really well in conjunction with the DRX 9000 because it's working perpendicular to the spine, which is at a 90-degree angle, as opposed to the DRX is along the same plane as the spine. So these 2 therapies work really well hand in hand. So super simple. Start with the one that is what feels like the top bladder. You can pump up by 5 or so. Pump up the other one, and that should intensify that. At no point in time should this feel pain, but you should feel a nice and easy stretch. Again, we're just trying to bring more water as much as we can into the disc spaces so that they heal over the long term. let all the air out. And you can do this, some of my patients say 10 times is enough, some of them say 15 times is enough. When you're doing this type of at-home device, do it to your tolerance and what your body says you can do. And of course, if you have any questions, you can ask me on your next appointment.